Hello there. Thanks for being here. My name is 𝗀𝗃 𝗏𝗏. I'm a Medicare agent located in Charleston, South Carolina, the #1 tourist destination in America, according to Southern Living magazine, for what that's worth. We help people with Medicare insurance in almost all 50 states, and those that we don't, we have partners that we work with and trust that do. We don't do Alaska, Hawaii, Massachusetts, I believe, but we do pretty much everywhere else. Washington, D.C., we don't do D.C. as well. While you're with me and more people are joining the stream, I want to take this opportunity to let you know about the important dates that are happening right now. These dates are important because we're in the middle of one of them as I do this live stream. We're in October 15th through December 7th. And why is that important? It's important because, I'll make that go away. 1 second. That's the beauty of live. The annual election period that Medicare is making confusing now, calling the open enrollment period, but it's not really open for anything to enroll in. However, you can see on the screen that most of the year, we have plenty of time to sign up people and help them with Medicare supplement plans. That's Medigap plans like Plan G, Plan N. Across the country, Wisconsin, I know it's different for you folks in Massachusetts as well, but for the rest of the country, it's standardized. The Plan G in California is the same thing as a Plan G in Florida. They're the exact same benefits. They never change. They complement original Medicare that you've earned your whole life, and they allow you to go to any doctor and any provider in the country that accepts Medicare, to include, as recently made news, the Mayo Clinic, which does not accept all Medicare Advantage plans. Johns Hopkins, MD Anderson, the rest of them. You can go to all those if you have original Medicare and a Medicare supplement plan. That's what we specialize in. I've been helping seniors for 26 years with that. So that's all year long. You can do a Medicare supplement plan. For Medicare Advantage plans, that is limited to October 15th through December 7th that you can sign up for one or change one if you're already on one. You can also change your drug plan. Medicare Advantage and drug plans change every single year, so it's very important that you look at your annual notice of change and make that selection for the new coming year. It's in January. You can also leave a Medicare Advantage plan during this time, October 15th through December 7th. A lot of people are choosing to do that. We have over 100 people on our calendar already that have said that they want to get off of their Advantage plan for various reasons. But there's another period of time that you won't hear much about. It comes right after this open enrollment period that CMS has now chosen to call it to confuse folks, and that's the Medicare Advantage open enrollment period, January 1 to March 31. If you're on an Advantage plan and we can't get to you to help you to either change that plan or get off of it, you have another period of time, so we can calm the jets just a little bit. January 1 through March 31, you can change your Medicare Advantage plan if you find that you're on one that does not suit you, so there's still time. And any selection that you do from that period of time, January 1 to March 31, whatever selection you make takes effect on the 1st of the next month. So if you do it in January, you want to change your Advantage plan or go back to original Medicare, you make that choice in January, it happens February 1. So that's available January 1 through March 31. What you can't do during that period of time is you cannot change your drug plan. You can get a drug plan if you're leaving an Advantage plan, but you can either change Advantage plan one to another or leave Medicare Advantage altogether from January 1 through March 31. Our phone lines are really jammed right now. That's not a scarcity sales tactic because I don't believe in sales when it comes to Medicare. We're actually helping people. But if you can't get through, you don't need to leave a voicemail after voicemail after voicemail. We got it, I assure you, but there are hundreds of folks that we're getting back to as expeditiously as possible. The best thing you can possibly do is to fill out the form on our site that answers the questions and then ask for specific information so we can get you plugged into our calendar in the appropriate place rather than wait for a phone call back and forth in the phone tag. I'm going to give you some very helpful links at the end of this live broadcast today that will help you to route to the information that you're looking for. And it actually will answer the majority of questions that I've been seeing come in through YouTube comments. I want to encourage you also, don't put comments where you have questions. If you have questions, then ask questions of us. I encourage you to do that. Don't just do a comment on YouTube, especially with a time-sensitive issue or a life-threatening issue, and expect us to get to that comment on YouTube. I sat down on Saturday this past weekend and went through 450 of them and got exhausted and had to get up because I was answering questions through comments on YouTube while the live stream that those people were replying to had all the website links. You could go in there and get the answers or fill out the form so an agent in my office can answer you. But YouTube comments are not really the best place during normal course of business to get questions answered. The questions are coming in right now, and I'm going to answer the questions that you're putting in live right now, but I also took some very common ones out of the comments so I can bring them and expose them in here and get some answers on that. There was some late breaking news that just happened today from the United States Senate. This was the Committee on Finance in the Senate, and this report came out called Deceptive Marketing Practices Flourish in Medicare Advantage. Hey, this is not Chris Westfall saying this, although that is my website right there, allaboutMedicareAdvantage.com. If you want to see this new report, which goes over it all in detail, all the things that they've been finding, they've been studying this all year about Medicare Advantage. Probably now that it's Medicare Advantage season is a good time to read this report. It's 33 pages long. I printed it out, got the whole thing right here, went through all day and highlighted a whole bunch of parts in there, and I can save you a lot of time. I'm going to run through a couple of the highlights real quick on here just for your entertainment purpose. I'm going to get to your questions. You can continue to add them there. This is all quotes from this report that you can get at the link below. But it says, seniors shopping at their local grocery store are approached by insurance agents and asked to switch their Medicare coverage. Insurance agents selling Medicare Advantage plans tell seniors that their doctors are covered by the new plans. Seniors who switch are finding out months later that their doctor is actually out of network, and now they have to pay out of pocket or can't see him at all. Seniors are receiving mailers that look like official business from a federal agency, yet the mailer is a marketing prompt from a Medicare Advantage plan or its agent. Insurance agents call seniors 20 plus times a day. Anybody else been familiar with that? Attempting them to switch to a Medicare Advantage plan. Widespread television advertisements with celebrities claim that seniors are missing out on benefits, including higher Social Security payments, in order to prompt seniors to call Medicare Advantage plan agents and broker hotlines. Woohoo! Really helpful there. Let's see. This form, for instance, is just a typical direct mail piece that, as an insurance agent, if I want to sell a Medicare Advantage plan, I can go buy this through any of the lead marketing companies, and it makes it look like it's really official, but it's not. Information submitted by states to this committee, this is the Senate Finance Committee, demonstrate that beneficiaries are inundated with fraudulent and misleading communication across all modes of communication. A number of states, they wrote to 14, I believe it was, Department of Insurance commissioners throughout the states, and they said that the use of the word Medicare is what's most frustrating. Medicare in the naming of these things, which are not Medicare mailers at all. And here's one, and I saw this, I believe this is the one that's in Savannah, Georgia, that's driving around making people think that it's actually with Medicare. And this was cited by the Senate Finance Committee on one of the deceptive pieces that are out there. And then the complaint was sent to CMS. This is not the government's bus. It's a private entity trying to get you to get onto one of those plans. The report continues, some people who fall victim to marketing and enrollment scams delay care. That's what I'm concerned about. They're delaying care because they're getting lied to, and then the care that they were promised is actually not given on many of these Advantage plans because of confusion over their benefits and coverage instability. Many feel frustrated and embarrassed that they were scammed. In a survey of state insurance commissioners, the reports are that an increase in complaints from seniors about false, misleading advertising. So this past year, they received more than twice as many complaints as they had the year before. Now, I don't know about you. Do you go into a restaurant and you're the one of those people that complains for everything being wrong on the menu, or your food was a little bit cold, or you didn't get something that you were? We're not that kind of family. We're not ones that raise holy heck when something's wrong in an establishment. Typically, we just go with the flow, and it's just the way things are going to be. A lot of people that we go out with, incidentally, that's how we interview all of our employees. We take them to our favorite restaurant for a lunch and a second interview, and we see how they interact with the wait staff. It is a very good insight into how they're going to treat other people, and we want that from our employees. We want to see how they are. Anyway, only 39,617 people in 2021 complained to CMS. That tells you that when seniors are many times mild, meek, and mannered, they will not go and make a complaint. These people had to go through such lengths that they had to make a complaint. So there's probably tens of thousands times more that were impacted. The report continues. 10 states, Department of Insurance, reported instances of provider network confusion, Medicare Advantage only, where the beneficiary was switched into a new plan and was unaware that their current doctors are not covered under the new plan's network until they began to use the plan. What was it Hillary said? Or was it Obama? We have to pass the plan. Or was that Nancy? have to pass the plan to see what's in it. That's what Nancy Pelosi said about Obamacare. Same thing, people are joining these plans, then they find out that everything is not as cracked up as it should have been. The complaint from this Oregon case says her mental health provider submitted claims to her Medicare Advantage plan, which were denied because it was out of network. Most Medicare Advantage plans, over 65% that people are signing up for, are HMOs. You have to go into their network. And then the highlighted portion, this is their text now. Original Medicare Part B had been paying 80% to the mental health provider visits, and the Medicare supplement was paying 20%. Well, shiver me tenders. There's a clear delineation there between Medicare supplement, which paid all the 20%, and you can go anywhere, versus the Medicare Advantage plan, which as soon as she joined it, she found out, oh my gosh, it's out of network. I can't go at all anymore. The agent then admitted to the unsuitable enrollment mistake. Out-of-network issues were raised in accessing medical and dental health benefits. States reported that because there is a limited time period during which an individual may disenroll from a plan, beneficiaries end up staying with the plan and mostly not complaining, even if it means paying for out-of-network services, all out of their pocket, by the way, on an HMO. That's all on you. And it doesn't go toward your max out-of-pocket. It is unclear from our interviews, the study says, and document whether plans willfully market plans with poor network coverage, or if systemic issues such as ghost networks are part of the problem. What's a ghost network? Glad you asked. Ghost network, it says, have been defined by the Government Accountability Office as providers who are listed in a particular provider directory as an in-network provider, but are either not taking new patients or not in the patient's network at all. However, beneficiaries only have a limited window to disenroll from a plan. I just talked about those windows. The annual election period from October 15th through December 7th is one period. Then they give everybody off for Christmas, I guess, because it starts again January 1 to March 31, where you can disenroll from a Medicare Advantage plan or change to a better one. These disruptions in care, beneficiaries have a limited time window, might not realize network problems until it is too late. These disruptions in care, whether from uncovered providers, medications, or services, can cause delays in needed care and be detrimental to a beneficiary's health. This is from the Senate Finance Committee. During this investigation, the committee also heard from Medicare beneficiaries who received a confusing communication from an integrated medical group, that means owned by an Advantage plan, informing certain patients that their doctor would no longer accept their coverage because it is out of network, and encourage impacted patients to contact our insurance specialist team. Quote, how to update and switch coverage. This example raises questions around the relationship between some healthcare providers, health plans, and insurance agents, and the gray line between referring patients for advice and steering patients away from or to certain health plans. This is one of those letters that the committee showed here. This is to inform you that effective, we will no longer accept insurance from your not contracted plans, but it's okay because here's our agent that we want you to contact. Contact their agent, everything will be just as it should be, and you'll be covered fully because you're on their insurance that they may or may not get a kickback from. We're going to get to your questions in just a second. If you've not yet submitted it, please put it in the comment below on the live stream here, and I'll get to your question as many as I can, as quickly as I can. I want to finish this report that just came out today, November 3rd, from the United States Senate Finance Committee. Goes on in the report, the Missouri Department of Insurance detailed similar beneficiary stories in a letter responding to our inquiry. This letter states a 94-year-old woman with dementia was sold a Medicare Advantage plan. No problem there, right? This consumer lives in a rural area, and the hospital and providers she utilizes are not in network with the plan chosen for her by the insurance salesperson. The plan did not allow for continuity of care, means they just didn't care, for the consumer, and forced her to obtain care miles away from her residence. I bet she wasn't told that. Under aggressive lead generation, the study says another example of misleading marketing reported by states is the Medicare coverage helpline. We've all seen this commercial, right? If you go to any establishment like a restaurant that's got televisions around, you'll see it just populate on different televisions back to back to back. Medicare coverage helpline, which first aired in 2018 and features former football star Joe Namath. This is the government report now. In the ad, Mr. Namath says, get what you deserve and the benefits that add money back to your Social Security check. After numerous lawsuits, the ad was recently updated to comply with current CMS regulations. However, it still fails to mention basic information about the Medicare Advantage program, including that not all providers are in network, and was only recently updated to mention that benefits vary by zip code, and they allowed it to stay on the air. The Joe Namath ad is sponsored by 𝗍𝗄𝗆, a subsidiary of Benefit Technologies, formerly known as Health Insurance Innovations. The company went on to face penalties for its misleading marketing tactics, entering into a multi-state regulatory settlement agreement to pay $3.4 million in 2018. As part of its settlement, the company was required to more closely monitor its sales and marketing practices and to more clearly advise consumers of restrictions on pre-existing conditions and coverage limitations of insurance products. The company was also required to improve monitoring of sales agents. These types of television advertisements can be particularly effective at targeting Medicare beneficiaries. For example, Missouri pointed out instances of consumers reaching out to insurance agencies after seeing a television advertisement. We get the calls all the time. Hey, I want to get what Joe Namath promised me. For example, an elderly consumer in a long-term care facility and without the capacity to make her own decisions called the number advertised on television. During the call, she was switched from one plan to another. Now, these are the recommendations. I'm going to get to your questions here in just a second. These are the recommendations from the report. During this AEP, it says the committee urges CMS to issue the following warnings for seniors and people living on disabilities. So far, CMS, who had a preliminary version of this report, has not issued this warning, but they should. If you're calling for a TV helpline, the federal Medicare program does not advertise Medicare Advantage plans on television. It's not Medicare doing it. These helplines will connect you with an agent or a broker. If you think you've been enrolled in a plan that doesn't work for you, call Medicare right away. You really should. And be careful what you click on. These Medicare call center, 1-800, whatever, these other organizations are making themselves look like they're Medicare, and they're not. At the last part of it, it says CMS has taken action to address the increase in marketing complaints. In the 2022 final rule, they have made the rule that third-party marketing organizations have to add a disclaimer, and you'll hear that when you call our phone line because we're completely compliant with this, reporting that we do not offer every plan in the beneficiary's area. So as my agents or anybody else that you're talking to on the phone, they should say on the beginning of any enrollment call that we do not represent all plans in your area. For information on all plans, you must go to medicare.gov or call 1-800-Medicare. However, we can see all the plans. And if we find one that's better for you and we're on the phone with you, we'll tell you to go to that plan, even though we don't represent that plan. However, in October 2022, CMS released the guidance notifying plans that they're going to have more oversight this year. That's great. And more secret shoppers. That's great. But look at the highlighted part. Starting when? In 2023, CMS will prospectively review television advertisements to make sure they meet CMS requirements. Not this year, folks. Sorry, you're going to continue to see Joe in its current form. Policy recommendation number 4 says, implement robust rules around Medicare Advantage marketing and close regulatory loopholes that allow for cold calling still. They'll say they're calling you about dental insurance, but wait, you're on Medicare? I've got some benefits for you on Medicare if you want to hear them. Now that we're on the phone about dental, that's what I called you about. They should prohibit Medicare Advantage plans from contracting with third-party marketing organization, agents, and brokers that design materials to suggest they are from the Medicare program. That's already the law, and they're not enforcing it now. This should include the use of the word Medicare in a business name. That's already prohibited under the 1966 Social Security Act. You're not allowed to use the word Medicare, and yet CMS, who has the authority to enforce it, does nothing about this. Happens all the time. Anyway, and using Medicare marketing logo. There's a bill proposed, and I talked about this on our last live stream. Today, I'm meeting with our local congressperson, Nancy Mace, this afternoon, which is why I've got to get out of here right at 5. We got time for questions, though. I'm meeting with our congresswoman to try to talk to her about this, the Save Medicare Act. So far, it's only got like 4 or 5 co-sponsors in the U.S. House. Not sure they're going to get to it in the lame duck session before January. But this bill will say that Medicare Advantage itself cannot use the word Medicare because it's not Medicare. It's the third-party option. It's the private party option that takes you off of original Medicare, even though you have to continue to pay for your Part B of Medicare. You can't use Part B is intended. You get all those benefits from a private entity. This bill aims to rename Medicare Advantage and just take the word Medicare out of it. which is the way it should be. So I'm going to encourage our Congress people to do that and sponsor that bill and support it. So most people are asking in the comments, at least 100 of them since last week, who do I contact to change plans? In every one of my videos, what fails to be seen for some reason is what I have in the very top, which since I just changed the screen, just went away. It's way up there, seniorssavingsnetwork.org. At that link, you will see where it says Medicare Help at the top, and then it's got various scenarios. You can find your scenario. It'll play a video to explain the parameters of that decision and what your options are, and then give you an opportunity to book a call with me in my office. So I would start with a website. We've got one exactly on there on how to change your plan. I started at first with my Medicare supplement, no premium. How did I get out of it? There's no Medicare supplement with no premium. Unless you're on Medicare supplement premium, no. It would be Part B has no premium if you're being helped by Medicaid. You're dual eligible for Medicaid in your state and Medicare. They can pay for your Part B premium, but there is no free Medicare supplement plan. Anyway, this Advantage companies convinced me to get them, not knowing they weren't the real Medicare. I've been changing different ones, Advantage plans, because everyone had better help than others. Now I want to go back to my original Medicare, and I wonder if I still will be able to go back to that with no premium. You cannot go to a Medicare supplement plan with no premium. I'm sorry, it just does not exist. But again, if you go to seniorssavingsnetwork.org, click Medicare Help, it has a scenario exactly for that, answering what you can do. I'm 64 and still confused about this whole conversation. Where do I go? If you go to seniorssavingsnetwork.org, there's an open enrollment button after you go to the Medicare Help, green button, that says all that you can do. It shows what the options are, walks you through step by step, and gets you a trusted person that's a licensed person in your state automatically with our scheduling system. Now, we have an 800 number. It works across the world. If you can avoid the 800 number by going to that selected area on the website, it'll answer your question and then have a contact form. And based on the results of the contact form, you can book a time on our schedule and skip the phone calls back and forth, like, are you available this day? Are you available that day? Hubby just enrolled in Plan G, February 2022. Can he switch to Plan N at this open enrollment? No. This time frame has nothing at all to do with Medicare supplements. We get calls from at least a third of our clients saying, now's my time to compare my Medicare supplement plan. It's not. It's really not. And in the update that I sent to all of our clients, which if you're a client, you can see that update email at the top of seniorssavingsnetwork.org where it says update. Click that email and it'll tell you if you're on a Medicare supplement, it ain't a changing. Nothing changes on your Medicare supplement ever. The premiums can change. We can shop better rates for your premium. But if we can do it after December 8th, it would save both of us a lot of availability. You don't have to do anything with your Medicare supplement. We can change your supplement 365 days a year, but it doesn't have to be during this time critical part. We're trying to help everybody with their Medicare Advantage questions because that's the purpose of this period. But we can definitely help you get off of the Plan G, and I encourage you to do that. I've got a link I'm going to show you at the end of this video that compares Plan G and Plan N, and it's what most agents won't tell you because it results in a 20 to 25% reduction in the agent's commission by telling you about Plan N. You must ask yourself, did your agent go over Plan N or just talk trash about it because they don't understand it? We explain the whole thing at the website I'm going to give you at the end of this. If you have Plan G, do you still have to pay 20% of Part B drugs? No. Plan G is a Medicare supplement plan, which pays that other 20% of Part B drugs. I've got a video you should look at on our channel that talks about Part B drugs and why it's so critically important that you consider Part B drugs. Those are drugs typically administered in the doctor's office. Why that's such a huge differentiator between Medicare supplement and Medicare Advantage. See, on Medicare Advantage, you typically have to pay 20% of the cost of chemotherapy, cancer treatment drugs, other drugs that are Part B drugs. Well, wait a minute. If I'm on Medicare insurance and I got to pay 20% of the cost, what is this Medicare insurance called Medicare Advantage really doing for me? That's a really good question. Look at your summary of benefits right now if you have a Medicare Advantage plan or you're considering one, and look under Part B drugs. Look under chemotherapy, cancer treatment. If you see which you will, that you're paying 20% of those drugs, then your sales agent is going to tell you, but hey, it's okay because you have a maximum out of pocket. And if you can tell me one cancer patient that started their chemotherapy regimen during the last quarter of the year and actually finished it before December 31st, so you can encapsulate all of your Part B costs, your 20%, and next year that can be as high as $8,550 out of your pocket, only to then come January 1 and reset that max out of pocket. So how good is that to have 2 times your max out of pocket for one regimen of cancer treatment? Let's look at the Medicare supplement. What would happen? Nothing. You don't pay anything. Wow. That's a big difference, folks. And to further make it worse, on a Medicare Advantage plan, you're going to go in a network. You're going to go to an oncologist that is in the capitated system. If you do that, it may not be MD Anderson, the Mayo Clinic, Cancer Treatment Centers of America. No, it'll be the lowest bidder in your region. That's who's going to be in your network. So all of your care must be done by the lowest common denominator in that network. That's the limit that you have. Conversely, on original Medicare and a Medicare supplement, you can go to MD Anderson, Cancer Treatment Centers of America, Johns Hopkins, the Mayo Clinic, anywhere you want to. You call them and say, I've got Medicare and a supplement, I'm coming, book me, and they'll get you in there. That is a life-changing difference, to say nothing of the fact that you don't need a max out of pocket because you're not paying any of the Part B drug costs on a Medicare supplement. That impacts people's lives, to tell the truth, on that way. So yes, Plan G, do you have to pay 20%? No, because you're on a supplement. I would like to know how to get a supplement plan, what is needed, and also like names of one of your agents that will serve me honestly and purposely in the Salt Lake City, Utah area, if you can supply. Thank you. If you go to seniorssavingsnetwork.org, fill out the form that best matches you. Are you new to Medicare? Are you on an Advantage plan? Are you on a supplement already? That'll guide you to the answers, and then a contact form where you can get on our calendar. And I guarantee you that I've vetted like the Dickens, the background check, the training, and everything of the people who are on the other end of that on our number. As a provider, this is enlightening. As a provider, it wastes mind-numbing amounts of our time to try to convince Advantage plan clerks to give our patients proper care, begging for prior authorization and needed care. Talking to their Advantage company pharmacists or other caregivers is infuriating, like talking to brick walls. This is a comment posted yesterday on my YouTube channel. I've heard that so many times before, and this is just this is like a needle in the haystack. If one currently has an Advantage plan, can they switch to basic Medicare? Yes, I outlined the exact steps on how to do that in a very detailed video and fashion, and questions and everything on seniorssavingsnetwork.org. Go to the top where it says Medicare Help and pick your scenario there. Much better than in the comments where I may not be able to get to it in time. These are some links that we have that make things easy. Let me go over a couple of highlights. How to start Medicare. When you're 6 months away from starting on Medicare, turning 65, or leaving an employer plan, I encourage you to go to How to Start Medicare. Pretty easy, right? StartPartD.com. This is for our period of time right now, the annual election period, where you can change your drug plan. Always good to get a fresh look at the drug plans for the new year, because they change sometimes very significantly. You can do that 24 hours a day at StartPartD.com, and you can sign up for the plan right there. It's very simple, just like the Medicare system is, except this is all customized for plans that we have chosen to work with. PlanNMedicare.com. You're considering Plan F or Plan G or Plan N. Here's my take on it, and I compare all three here. And my track record of what I predicted in 2016 has been proven right every year since then. Look at the proof on that website. AllAboutMedicareAdvantage.com is a whole bunch of research, including the latest study that just came out, the report today by the Senate Finance Committee. All those resources are there. I encourage you to read through those if you're considering a Medicare Advantage plan. If you want a Medicare Advantage plan and you don't want to talk to an agent, you want to look at the plans in your area and you don't want to talk to anybody, I've created this resource called MedicareAdvantageNearMe.com. How simple is that? You can put in your zip code, put in your doctor, put in your drugs, and it'll sort those plans that we have available for you right there. And you can sign up for the plan from October 15th through December 7th, and it'll take effect on January 1. You don't even have to talk to anybody or get on anybody's calendar. You want to see what's available, you can go to MedicareAdvantageNearMe.com. A lot of people have been asking us for dental, vision, hearing plans. Which ones are the best ones that we like? You can look at that at dentalsavingsforseniors.com. Video explaining it, and you can book an appointment with our people if you're interested in that plan. And then we've had hundreds of people in the last week say, I'm on Medicare due to disability, Social Security disability. I'm not yet 65 years old. What do I do? What are my options? This is millions of people across the country are looking at this change right now because it's Medicare season, right? For Advantage plans. If you go to MedicareOnDisability.com, I'll apologize right now. That video looks horrible with the colors. I can't get the colors fixed on that video, but it does explain all of your options. And it's a state-by-state basis as to whether we can help you or not. Because offering Medicare supplements under the age of 65 is completely up to the state law, whether they require the companies to do that and whether or not they regulate what the prices are. There's some states that require it, but they have no limit on what the prices are, and that's pretty horrible. So here's our contact information, and I'm going to go to your questions. I'm going to go to the top. If you're not yet putting your question, please do so. And we got a hard, fast deadline. We're doing great on time. My doctor takes original Medicare, but is on the ACO REACH program. They are all in my area. Do primary care doctors still choose from certain doctors so they make an extra profit? Yes, they do. And it's not so they can make a profit. It's the profit's the end result of it. But what they're doing is they're trying to save as much money as possible. And they get to share in up to 60% of the savings that they show to Medicare. Dental savings for seniors is which one? AmericanDentalCoverage.com. Whoops. Let me change that. Thanks, Hannah. Hannah's running things from the other room and making sure things are correct. Woo! Love that. Got to have somebody looking out for you. AmericanDentalCoverage.com. Thank you, Hannah. All right, back to the show. Sorry, it is live, right? So the ACO REACH program is a model from Medicare trying to get a managed care perspective on non-managed care doctors. You will have to be notified by a letter that your doctor has joined the ACO REACH program. If you get any inkling whatsoever that they're trying to skirt some care or put you with a cheaper test and a cheaper test rather than the best test, you really have to be an advocate for yourself these days, I have found, and look out for yourself and find out, is this the appropriate test for me in this certain condition? And you can go to a different provider that is not part of the ACO REACH model, because the incentive there is on getting you the best care. And they'll say in the ACO REACH model, it's getting the best care for you too. It's just saving the most amount of money so the doctor's group can participate in those savings. On the switch from Medicare Advantage to Medicare, please highlight the out-of-pocket cost for supplements or gap. There is none. Why is there no out-of-pocket cost on Medigap? Because you're not paying anything. On a Plan G, you're not paying anything. You go in the hospital, you don't pay anything. Well, what if I go to the Mayo Clinic and I'm admitted under Part A of Medicare and the supplement pays the Part A copay? You're not paying anything. You're paying the supplement premium. And you go to the hospital in Timbuktu, Oregon, or Jacksonville Beach, Florida. It does not matter. That's the difference between original Medicare and a supplement and a Medicare Advantage plan. Medicare Advantage plan is typically no cost to you. Why? Because they get you every time you need something from them. They either get you with a denial of care, a prior authorization requirement, appeals required if you're going to fight either one of those things, a limitation on the network, and then copay. Now, I've had some people write to me this past week and say, my plan's amazing. I have very limited income. I have zero copay at the doctor, zero copay at the hospital. Yeah, it's a limited network, but it's amazing. That's because you're on Medicaid and Medicare. And those are different opportunities for people. Not everybody in the country is on Medicaid, but for those who are, yes, I'm sure you think your Advantage plan is amazing with like a $600 max out of pocket and that kind of thing. It's just not reality in the real world for most people on Medicare. Every case is different. And that's why we answer people's questions based on their specific case. There's no one plan that's better for every single person. That's the best. That's why we want to listen to you and then make a recommendation rather than just flood you with information, leave you out there to flop around on your own or submit a comment on YouTube, there's really help behind this microphone. And that's what I'm trying to offer to you. If I delay getting dental insurance when I sign up for Part B, beginning at age 65, am I penalized? Dental insurance you can buy any time you want to. Now, some of them have waiting periods for the major care, like a 12-month waiting period for major dental services. But the ones that we represent get better over time. The longer you keep it, the more of it covers. They can have a network of providers that will save you like 50 or 60% when you go in the network, but still you have all this money that you can use in the network or out of the network, totally your choice. We'll explain that to you at AmericanDentalCoverage.com. But no, there's no time period for a dental plan. You can sign up for one anytime you want to, year round. There's no waiting period for, can this plan go into effect? It can go into effect right away. What is the most important thing to choose when picking a Part D plan? I'm looking at two plans. Both have the deductible, same monthly premium, but one tells me I'll spend $900 more a year than the other. So the part you're not looking really close into, which you have to is where do your drugs appear on which tier? If more of your drugs are on tier 1 or tier 2, that's great. That's the disparity. That's the difference here. I did a video about Part D plans and what they're not telling you. I encourage you to go see that video on my channel, because what it talks about is you signed up for a Part D plan based on today's estimates, which is what that is. You can sign up for the lowest possible cost, and that's what you should be doing. However, they can change their formulary throughout the year. They can change their prices, and they can move drugs in and out of tiers throughout the year. Little known secret about Part D, I'm letting you know, and I did a full video on it with examples. You can look at that. But the only thing you can go based on is what you're seeing today. So I would pick the lowest cost, which our program will automatically select and show you side by side at startpartd.com. Startpartd.com. It's right up there. Please repeat the coverages that Medicare does not cover. I'm not sure which coverage you're talking about. Dental, vision, hearing. That's why we have a standalone dental, vision, hearing plan. Not sure if that's what you mean there. Thank you, Ms. Murphy. Is underwriting required for changing from high deductible Plan G to Plan G or Plan N? It depends on your state. Most states, yes. New York, no. California, yes, because you're going up in plan. Washington, yes. Oregon, so it depends on the state. If you want to know how underwriting works, I cover that too. I'm going to add that right here. If you want to see how underwriting works, can I qualify for Medicare supplement plan? Senior Savings Network or underwritten. I know that's a long word there, but if you go to that page, seniorsavingsnetwork.org/underwritten, I go over how the underwriting works and give examples on that. So you can see if you can qualify and what state you'd have to qualify in. Let's see. Let's see, blurry, unable to read along. Okay. They should not be able to call their product Medicare. Yeah, that's true. How can I find a good RX plan? We have United Healthcare. We pay more for our medication than they do. We're paying $94. All I'm telling you is these plans are changing. If you're basing that analysis on your annual notice of change, you may want to look at it closely because, and I say that because they're changing a lot. And I don't know if it's based on last year that you're talking about or the new upcoming year, but those plans are changing a lot. So if you're just basing it on what you had and you're looking at something new, I would encourage you to look at our site up there called startpartd.com, startpartd.com, and you can look at all the plans. And I would encourage you to change plans or at least get in the posture of changing plans every year. Part D is a subset of Medicare Advantage. And one of the little known things about Medicare Advantage is, and Part D, because it's part of it, they change every single year. You have to affirmatively shop a plan on Medicare Advantage or Part D every year. They change drastically. Supplements don't ever change. Big difference. Big difference. How do I enroll without auto enrollment packet from Medicare if I don't get it before December 7th? If you're talking about automatically enrolling based on Social Security income, you're drawing Social Security and you're turning 65, so they're automatically going to enroll you in Part B and then send you a bill for 3 months of premium at once for Part B. If that's what you're talking about, you can opt out of it. You can go on their website, or you can call Social Security and you can send them the card back. Say you don't want it. I would only do that if you have qualifying other coverage. That would typically be an employer plan with more than 20 employees. If you're on an employer plan with less than 20 employees, then you'd better get Medicare because it's primary. Not having done so will subject you to a penalty for getting it later. The penalty for not getting Part B when you should is 10% added to the Part B cost for every 12-month period that you went without Part B. I would not recommend that. I do not plan to receive Social Security once I turn 65. How do Part A and Part B payments get paid? Initially, when you sign up at Social Security website, which you can go to my website up here called How to Start Medicare, and I explain all this, but they're going to send you a statement wanting 3 months of premium. You can immediately then go online and change that. You can even change it to a credit card now. That's new. But you can change it to a checking or savings account. Not good to use a credit card for anything having to do with health insurance, even if it's an option, because credit cards expire. It's a built-in expiration on that. And losing health insurance is the worst possible thing you can do. Happened to a lady that lived across from me when I was a deputy sheriff. She fell, broke her hip, was in the hospital, skilled nursing, didn't get her Part B paid. And so she lost it. Big, big, big problem. If you are married, how do you get discounts? Is it combined if you go group, G, or N? It's not group, and every Medicare supplement is individual, but there are many companies out there. I think it started with Mutual of Omaha, then Aetna, Ascendo, now ACE. A whole bunch of companies are offering household discounts where you don't even have to be married. You just live with a person that's like 50 years of age and over. You can get up to a 14% discount, both of you, if you're separate. Or if it's just you and you're living with a senior or 50 or over, you can, and some of them even 18 and over, you can get that household discount. But in almost all states, it's illegal in, is it New Jersey and Florida, I believe. The household discount is not available at all by law there. Sometimes it ranges from 5% up to 14%. We have the information on all those if you want to look. But it does not always require both of you to get a plan at the same time. Some plans do that, some plans don't. What we like to do is compare all of it with a household discount and without it. Worst thing that can happen, and we know one insurance company that does this, they'll give you a household discount, but if your spouse dies, they take it away. So effectively, they're raising your premium during your worst possible time ever. So we don't recommend that. Massachusetts, can I switch from, I don't do Massachusetts because they've opted out of the standardized Medicare supplement regime. But no, it's not guarantee issue there all the time. I'm in New York State. I am licensed there for sure. Who can I go to for consultation to get the right Medigap plan? All these links up there, that seniorsavingsnetwork.org. Go to Medicare Help, pick your selection, your situation there. New York, you can change plans anytime. Let me tell you a little secret just between you and me. Come closer. If you live in New York, you can change plans anytime you want to with no underwriting. So if you get like on a high deductible plan G in New York, and then you're going to go through some massive treatments, you can switch over to the real plan G as soon as the first of the next month. So you better do your application during the month before, but all the effective dates happen on the first of the next month. So in New York, you can take advantage of the loophole there by getting on a very inexpensive high deductible plan G. Switch to a plan G if you're going through stuff. And then when you're all better again, go back to high deductible plan G. Flip as many times as you want. Unique to the state of New York. You heard it here. Let's see. Why did premiums increase due to Alzheimer's drug when Medicare does not have drug coverage? Because the coverage determination from Medicare was done way after they anticipated that it was going to be there. It was a dang fool errand, really, to raise everybody's rates at the worst possible recession or inflation that the country's seen, at least in my lifetime. It was ridiculous. And now they've just undone it and then making it look like they did you a favor. Should have never raised it anyway, on the off chance that this was going to be approved. It was going to be the efficacy tests were going to be borne out, which they weren't overall. It was just ridiculous. Do you have to pay for Part B on top of Part G or N and D? we got some parts in play there. There are different parts of Medicare: Part A, hospital; Part B, outpatient; Part D, drug plan. That's original Medicare, the chassis. The supplement is a plan that sits on top of the chassis and pays all the other hidden parts. If you don't have the Medicare supplement plan, then you are exposed to Part A deductibles and co-insurance, and Part B co-insurance, which is 20% of an unlimited number. So that's why people get a Medicare supplement, to complement original Medicare. I don't recommend Medicare without it. You have to, everybody on Medicare has to pay for Part B. Even the people that leave Medicare for Medicare Advantage have to pay the Part B premium. The difference is the Part B premium on Advantage goes to that insurance company, the private plan, and they do with it what they wish. On original Medicare, it goes toward the Medicare Trust Fund. So everybody has to pay for Part B. That's correct. Then if you get a supplement, it is on top of the Part B premium. So parts and plans are a little bit different. And then Part D is the drug plan component. I don't recommend not having one, but that's your choice. You don't have to have Part D drug plan. That is your choice. Let's see. I think this is about enrolled in, I know this is about Advantage info. No, it's about anything, but I have enrolled this year in Mutual of Omaha and would like to continue that automatic deduction if Kendall can reach out to me. Okay. Rather than that, can you send her an email, kendall@seniorsavingsnetwork.org, and we can help with that. There should be no interruption then if you're already on Mutual of Omaha and it's already being deducted. Sometimes with carriers, we're not allowed to make deduction change information because the banking information, sometimes they don't want to hear from us. You can also call your 800 number. I think it's 800-788-7000 for Mutual. I could have that mixed up. There's 775-6000. Anyway, it's on the back of your ID card, and they can change your payment information all the time. So on a supplement plan, you're covered 100% except for prescription drugs. Yes and no. You're covered for whatever Medicare would approve. If it's medically necessary, then it's going to be paid for at a Medicare provider. The supplement does pay that other part, yes. And prescription drugs, if it's a Part B administered drug, typically administered in the doctor's office, like rheumatoid arthritis infusions done in the doctor's office, like Prohibit, the bone density drug that's fantastic, administered in the doctor's office, could be $6,000 a month. No, it's paid for by Medicare Part B and your supplement insurance. It could be as high as 20% if you're on an Advantage plan. But so all the Part B drugs are paid for with your supplement. The other prescription drugs, right, you have to have a drug plan for that. Is there a high deductible plan in? No, there is not. Probably never will be. Plan in is a really good value anyway. Calls would ask if we got a new Medicare card and they would send a new one. That's an old scam. Absolutely. Sure is. All right, I've got a few minutes left. And if you did not get your question answered and it's something that we can help you with coverage, please go to the website instead of the YouTube comment. If it's timely, if it's urgent, please send us a question to the agency so we can help. If I'm on Medicare with Part D, but no Medigap at age 66, can I get one with no underwriting? Depends on how long you've been on Medicare. Some people are 66, just get Part B started because they left an employer plan. If that's the case, if you're within 6 months of starting Part B, yes, it's still open enrollment for you, your initial election period. You can get on any Medicare supplement plan with no problem. But if that's not you, if you've already been on Medicare for a whole year, go to the link at the top here, seniorsavingsnetwork.org/underwritten. I'll tell you exactly what's involved in getting approved. It's not hard. It's really not hard. But I've already gone through that over there, so I won't go through all of it right here. Oh, thank you very much. Appreciate that. I have my original card. Will your team be contacting me sometime before December 7th about rates? I don't know if you're on our list or not to contact you, but we don't look for people to call about anything changing. If you're on a Medicare supplement plan and you're receiving a rate increase, you will have received an email, probably a voicemail from us, and a link to get on our schedule to review that plan with you. But we can do your Medicare supplement review any time of the year. But we don't contact people about their Part D to get them to change. That's why I send out tens of thousands of emails to people saying what those resources are. You can go to startpartd.com and you can look at what the Part D plans are for the new year. That's all available to you, but we're not going to be cold calling anybody for sure. We have hundreds of people to try to get back to right now. If I'm currently on a Medicare Advantage plan and want to switch to a supplement, do I have to go through an underwriter? Yes. In Michigan, you definitely do. You can find out what's involved in that by going to the scenario under seniorsavingsnetwork.org, click on Medicare Help. I've got a scenario there and I talk about the time frames, the steps in which to do it. If you do that out of order, it can really screw you up and leave you without insurance January 1. You have to do it in order and we can help you with that. We're experts in Michigan. Yes. Michigan was the second state that I started working in outside of Florida. And I added Michigan, I think 2008. Let's see. Being overcharged by $5, making us think we're getting a break. I don't know what that means. I'm sorry. What kind of things would Medicare not cover? Experimental drugs. I would say acupuncture, but they just started a program where they're starting to cover certain parts of acupuncture now, certain types of holistic things that are not medically recognized. Medicare won't cover those things, to the shock of many people that are retiring. When you retire at 62, do you have to wait 2 years to get on Medicare? Medicare starts at the age of 65, unless you've been on Social Security disability for 24 months. Then you get Medicare under 65, and a whole range of different options there that you can see on MedicareOnDisability.com. But for everybody else, yes, it has nothing to do with when you retire. It has to do with what the law says, and that's 65. Yes. Is Mutual of Omaha better than United Health with AARP? AARP is not an insurance company. You can see the report in Congress. There's a post on my site where Congress did an investigation. Watch, all the people are cringing right now. That AARP is supposed to be a nonprofit, but they make over $600 million a year from just endorsing United Healthcare. To ask if they're better or not, I can tell you it's a for-profit organization with stockholders. I used to be one. I used to work for United Healthcare in Florida in 1992. Right before I went to the sheriff's office there. However, Mutual of Omaha is owned by the mutual people. So it's a mutual benefit organization. It's owned by the actual members. So I have a significant life insurance policy through Mutual of Omaha. I'm also an owner, not just of the policy, but of the company, because it's a mutual company. Their focus is on trying to take care of the members as opposed to a shareholder. In that regard, holistically, I would say, I would rather be a member of an organization that's a mutual organization than a for-profit. Anyway, draw from that your own conclusion. Let's see. I am over 20 employees plan, but Medicare out of pocket is less. But I do want A, B supplement DRX. I'm just worried I won't receive auto enrollment to Medicare before December 7th. December 7th has nothing to do with your situation. If you've not yet started Part B, and you're on an employer plan, you can do that anytime you want to. It has nothing to do with December 7th. December 7th is for those people already on Medicare that need to make a decision on their drug plan or on a Medicare Advantage plan. If you want one, that's what this time period is for. Anyone considering leaving an employer plan where you've got qualifying coverage can do that anytime. I go over that in great detail at the website called howtostartmedicare.com. I've got the forms you can download to start Part B, but you can do that anytime you want to. Don't be stressed about December 7th. Let's see. I appreciate you saying that. Our office is located in Charleston, South Carolina. It's an amazing destination. But yes, we also service Texas and the rest of the country as well. Advantage Plan wanted to charge me $600 for an osteoporosis drug. Now I'm on Plan N and looking forward to my medication. Good for you, Debbie. Good for you. I have a cousin who's a doctor, works in what do you call that? Whatever it's called, orthopedics. That's it. Bone density type stuff at North Carolina, big hospital system. Gosh, why can't I think of it? Anyway, I did an interview with her on this channel about bone density, really good information there. And she is an expert on drugs like Prohibit and the things that are administered in the doctor's office. She sends us referrals all the time for people who are on a Medicare Advantage plan and they cannot believe what's going to happen to them because they have to take Prohibit and the other bone density drugs. Thank you very much for that positive comment. On a $378 copay most of the year, then I pay $75 last part of the situation I accept Humana in Arizona. I don't know your particulars on your situation on that plan, but I would encourage you to go to either an independent broker to look at your Medicare Advantage plan. I know our calendar for Medicare Advantage is almost full through December 7th already. So you can do some other things. You can go to MedicareAdvantageNearMe.com and compare your plan for next year with the other options there and sign up for one that may be better. If you don't like it, you can change that Medicare Advantage plan from January 1 through March 31. So let me repeat that. You can go to MedicareAdvantageNearMe.com, compare your Medicare Advantage plan, sign up for one before December 7th at midnight, which is my birthday. Happy birthday to me, the season's over. And then it'll kick in on January 1. You have until March 31 to get off of that plan by changing to another or going back to original Medicare if you can qualify for a supplement during that period. If you're confused about your plan, please reach out to somebody you can trust. If it's not me, call somebody you trust. I would not call 1-800-Medicare because they're going to push you into a Medicare Advantage plan. That's the purpose there. If you call 1-800-Medicare, they cannot enroll you in a Medicare supplement. They'll provide you with an alphabetical list of outdated state information because Medicare supplements are regulated by the states. So if you want a Medicare supplement, don't call Medicare. However, if you want a second opinion, go to the website up there, please. Put your information in under Medicare Help and find your scenario. How does B work with that? I don't know what that was. Awesome, Troy. Also Pearl Harbor Day, as you well know. Well, that's all the questions. I've actually gone through the whole feed. I did not get to every single one of them. Some of them are so long and specific, I didn't want to call out your name with a specific health condition. Please don't put questions just in YouTube comments. Reach out to an expert. If it's not us, it can be Medicare.gov as to what's covered by Medicare. But if you want an expert in Medicare supplement, the difference between the two, and somebody who will give you an unbiased recommendation based on your particular situation, then I encourage you, reach out to us. Go to seniorsavingsnetwork.org, click on Medicare Help, and you'll get help that you deserve. If we can't get to you by December 7th, I apologize, but we're here all year long helping with Medicare supplements because you can enroll in Medicare supplements and change them and compare them 365 days a year. This time frame, I'll go back to the original. This time frame, October 15th through December 7th, is only for comparing and changing your drug plan that'll start in January, or comparing or signing up for or changing a Medicare Advantage plan. Your Medicare Advantage plan could or could not have a drug plan component built in. I won't get off on the tangent here, but I will tell you that if you get a Medicare Advantage plan, it is very important that you look at the drug plan that's rolled into it. Oftentimes you might find, I got a zero premium. My doctor appears to be in the network for now. That's subject to change anytime during the year, by the way. So are the hospitals. But everything looks good. Go look at your drugs, because on an Advantage plan, they're taking an off-the-shelf generic drug component and slapping it into major medical insurance. That's what that is. That's why they call it MAPD for short. Medicare Advantage and Part D sucked into one. One of the benefits of having a drug plan as a standalone, which you can't have with a Medicare Advantage plan, you either have Advantage or drug plan. On a drug plan that's specifically tailored for you, you can put in your drugs, or if you take none, just take the cheapest Part D plan out there to avoid a penalty later on. Put your drugs in at startpartd.com, for instance, and you'll see the drug plans that are tailor-made for you. That is, that the deductible, the copay, the pharmacy, and the tiers line up best with yours. And how do you tell that? I've got the video that explains that at startpartd.com. But what you're looking for is total out-of-pocket costs for the year on your drug plan. Is it exact? No, because those things can change and they vacillate a little bit during the year. These are estimates. And you can see one plan next to another. And on my website, startpartd.com, you can sign up for that plan. Another little tip: if you sign up for a plan, either a Medicare Advantage plan or a Part D drug plan during this time frame, and you change your mind, hopefully it's not from listening to 𝗀𝗽𝗋𝗆, help me. If you change your mind on a drug plan or Medicare Advantage before December 7th, all you have to do is simply wait one more calendar day, so that CMS, who processes that application, will see, oh, this is the later day. They don't look at the minutes of when it was submitted. They look at the date. So let's say it's November 3rd. You submit an application for a drug plan. You're like, oh, no, wait a minute. I want this other drug plan. Wait 1 day and submit the application again the next day for the new drug plan that you want. The last one in on December 7th at midnight is the one that will take effect in January. January 1 to March 31, you cannot change your drug plan. You can't. You're locked in for the whole year. One way you could change your drug plan is moving outside the service area by changing your address with Social Security and Medicare. If you do that, you get another bite at the apple. If you change states, you get a new drug plan based on your new location. Oh, this is a really good one that everybody asks. I have a Plan G. Let's see here. Where are those links? Right there. Bam. I have a Plan G. Can I shop for a cheaper Plan G with another company without suffering any bad consequences? We get that question all the time, Mary. I'm so glad you asked it. There are no consequences. There's no credit check. There's no inquiry made to your company. No one will know that you're applying for a new company. And what we always tell our clients is when you apply for the new company, don't change what you've got until you hear from us. Once we've got the approval with the new company, then you notify the old company to cancel at the end of the month. And there are no pre-existing conditions or waiting periods from changing. As long as you've had continuous coverage for the last 63 days, if it's more than that gap, then there's a problem, potentially. We also have companies that don't have pre-X at all, but I digress. There's no interruption in your coverage whatsoever. You keep going to your same doctors, you keep having everything, but your rate goes down. I started this business helping specifically with Medicare, just totally changing people's plans to save them money. $2,000, $4,000 a year, I was able to save people money by changing their Medicare supplement plan. Because believe it or not, most people will get on a Medicare supplement, love it so much that they don't want to turn loose of it. They don't want to change it. Well, I got news for you. They go up in rates, and change means opportunity for us. We can go in there and save you money. If you want Plan G, great. All the best to you. But let us shop it for you if you've not done that in 2+ years. And we can shop it from December 8th until the next crazy season starts. We can shop it year round. You can get on our calendar. But go to seniorsavingsnetwork.org/underwritten. That one right there. It'll go through what's involved in the underwriting process. It's just questions. There's no blood work. There's no exam, nothing like that. We can go through those questions real quick and see if you qualify for a better plan. If you shop your plan every 1.5 to 2 years, I can guarantee you'll save money. The thing that we've been really good at is being very selective of the companies that we choose, so that we're choosing the companies that don't have crazy rate increases. And that's what we're going to do for you if you'll let us do that. So if you go to seniorsavingsnetwork.org, click on Medicare Help at the top, choose your scenario, and get plugged in and let us help you. If there's an opportunity provided there to get on our calendar, please use that and provide as much information as possible so we can help you as soon as possible. But we can do the Medicare supplement change year round. Does not have to happen by December 7th. Thank you all so much. I really appreciate you being here. God bless you in all that you do, and I hope that you're staying safe out there and staying away from those commercials and the cold calling people. Stay tuned. More news about Medicare as it happens. Literally, this happened today with the study out of the Senate Finance Committee. If you missed that, please go back in this live stream and watch that part again. Very timely with this Medicare season. God bless y'all. Bye-bye.